My name's Lauren. I am Business Development Manager at Care Leader here at Home Instead. And I'm really pleased to be able to introduce you to Mary Jordan today from Adapt Dementia, which is an organisation supporting people with dementia and those who care for them. Mary, I know you worked previously for a long time with the Alzheimer's Society.
Sorry, yes.
And you have worked in the NHS for many years as well. And Mary's actually also written 8 books. With all different titles. One of them is The Essential Carer's Guide to Dementia. And you most recently just held up is Dodging
Dementia.
Dementia.
It's about avoiding it.
Yeah, okay.
If you can.
So we have an expert here. All the knowledge is available for us. So yeah, welcome, Mary.
Thank you very much for inviting me.
Pleasure. So firstly, I'd like to just know a little bit about you, how you first got involved in this field and what led you to specialise in dementia.
Well, first of all, my mother-in-law had dementia, which is what got me interested. That was quite a long way back. And then I took a job with Alzheimer's Society. I was with Alzheimer's Society for 9 years. And really everything rolled on from there. So, yeah, it just catches your interest.
Yeah,
and I got really interested, and I really enjoy working with people who have dementia and with their carers.
Yeah,
so yeah,
lovely. So the webinar objectives today, the reason that we thought we'd put this on at this time of the year is basically to help people gain a better understanding of dementia in general, if they're on the first stages of the journey. We thought people may have spent some time with their loved ones over Christmas and noticed a few changes in behaviours.
Yeah, it's often a busy time this time of the year because of exactly that.
Yeah.
People have spent time with mum or dad and realised that they're having a problem.
Yeah, and maybe things aren't quite what they were before. Or maybe people are going to be watching this who are living with somebody or caring for somebody who's living with dementia and have recently gone through a progression in their condition, and I'm not sure how to deal with this new stage, or how to adapt. And
yes, and there's a lack of information out there for that. You get the diagnosis, but you don't tend to get ongoing support from the NHS. So.
Okay, so yeah, this is why we're hoping to do this today, to answer some questions. So yeah, I'll go straight into the first question, which is basically, what is dementia and how does it differ from natural aging?
Well, I'd like to say that dementia is really, it's not an illness in itself. It is a description of the symptoms.
Okay.
So people like to say it's an umbrella term. It's just a term. Dementia is the symptoms that people have from various illnesses. So the main one that everybody's heard about is Alzheimer's disease, and they think about 60 to 70% of people with dementia have Alzheimer's disease, but there are other forms of dementia as well.
Yeah.
They all have similar symptoms. That's why dementia is the term for the symptoms. Differing from normal aging, I think I worked very closely with a consultant psychiatrist once who's in the diagnostic clinic. And he once said to me that the real thing, the line that you draw, is when people can no longer manage their everyday activities. So simple things like doing the shopping, managing your money, keeping on top of the housework, simple things that people have been doing all the time. When they can no longer manage those, that tends to be the line between what we call normal aging and a possible cognitive problem.
Okay. So the next question is the timeline, and when is it diagnosed, and why is early diagnosis so important? So when you're thinking of, or if you've got suspicions and things, changes in a loved one, what would you do next? What's the first thing
The first thing has got to be to get them to the doctor, to the GP.
Okay.
In this country, everything is accessed through the GP. So you really don't have a choice. You need to head for the GP. And the GP will then usually do some simple tests, because there are things that can make it appear that you have dementia when you haven't, like a urine infection, for example.
They can show signs of confusion.
Some medications can make you have memory problems. People don't realise that.
No.
And certainly vitamin shortages. So the doctor will do blood tests for all those things to eliminate those first before he goes any further. We hope he will anyway. And then they would refer the person on to the community mental health team.
Yeah.
So
or do they sometimes call it the memory clinic as well?
It's often called the memory clinic.
Yeah.
Yes.
Okay.
It's run by the community mental health team.
Yeah.
Normally a consultant psychiatrist who will make the diagnosis.
Okay.
Sometimes if people go down the private route, they will be referred to a neurologist instead. So there's two lines, but generally in the NHS it's a psychiatrist for older people, specialising in older people.
Okay. And when you get that early diagnosis, do they immediately tell you what type of dementia you have, or is it just
They usually make a diagnosis of a type of dementia, but they don't always know.
Okay.
So in this country, there's quite a good diagnostic route because you will have a dementia test, which is on paper.
Yeah.
And then you will usually have a brain scan, and it's the brain scan that will show if there are changes in the brain that indicate deterioration.
Yeah.
So then the doctor normally will say, I think it is this type of dementia, because it's very difficult to pinpoint what type of dementia it is.
Yeah, and it's not until maybe the symptoms progress that we can actually determine which type. Or
they may not have all the information to hand. They only have a short, even the psychiatrist probably only has a 45-minute appointment, so you can't always. So sometimes things become clearer later.
Yeah.
So there are some forms of dementia where the symptoms are quite obviously different, and then Parkinsonian dementia, for example, is fairly different, and the doctor will be able to decide if it's that. But generally they'll say, I think it's.
Yeah. Okay. And why do you think it's important to get that early diagnosis and get?
Well, people talk a lot about early diagnosis and how important it is. But from my point of view, I think, well, the most important thing for an early diagnosis is if you can do something about it. And dementia is something that's quite difficult to medicate. But I think it's good for families to get the diagnosis, because often they think Mum or Dad's just been difficult. Oh, I don't know why she's getting like that. Or all the neighbours are really cross with Mum because she's so rude to them or something. When you get the diagnosis, at least you know.
It gives you a reason.
Plus, the diagnosis will give you access to attendance allowance.
Right. Yeah.
And the council tax disregard, which is money, basically. Yeah. So that's important.
Okay.
There are drugs for dementia, but they are of limited use. But for the people they work for, they work.
And do they? I mean, I know they don't. There is no cure.
No.
But there are, like I said, medications that can slow the process.
Yes, they can. Yes, they can be effective for some people,
but not everybody.
No.
Okay.
No. Some people don't notice any difference.
Right.
And some people can't tolerate the side effects. We always have to remember every medication has a side effect.
Yeah, it does.
And some people can't tolerate the side effects. And then this is not me, but the psychiatrist I used to work with, he used to say to people, well, don't worry about it because it's of only limited use.
Yeah.
So.
Okay.
Don't worry too much if the medication is, isn't for you.
Yeah. Well, that actually leads me on to the question I was going to ask next, which is, what treatments are there or medications that are there available to help with it?
There are 4 dementia drugs, well, 3 dementia drugs that work in the same way. And there's another drug called memantine, which is more of I'd like to say a mood drug, but it's not like an antidepressant, but it can change the way people manage their moods.
Yeah.
So that's often prescribed with one of the memory drugs. So those are the 4 basic medications that are available.
Okay.
Obviously, if your dementia is due to a vitamin shortage or something, then the doctor will prescribe that vitamin, and then you may find that you don't need anything else.
Oh, okay. So it's very specific to that person.
Yeah, it's very important to see the doctor and exclude anything else.
Yeah, and
You
get
may
the
not have
right.
dementia, you know.
Yeah, exactly.
Yeah.
And get the right treatment for
Yeah.
that person. Yeah, and
Yeah, absolutely.
and is there any therapies available or any other ways?
Yes, there's a therapy which is recommended by the NICE, which is the National Institute of Clinical Excellence.
Yeah, mouthful.
And it was recommended in the Lancet, and it's called cognitive stimulation therapy.
Okay.
And I actually run some CST groups, and I have seen the benefit that people get from it. It's not a cure. We've
No.
just established there is no cure. But it makes people feel better. It makes people feel in control of themselves.
Mm.
And because people with dementia attend on their own without the carer, they feel more empowered.
Okay.
It's all about them.
Mm.
And they can express themselves and say what they like. Very often, I'm sure you're experienced with this, people with dementia are afraid to speak out in front of other people in case they say the wrong things.
Yeah.
In our groups, that doesn't matter.
Well, that's a real nice environment for them to be in. So what actually does it involve, the cognitive stimulation therapy?
It involves a lot of different things. It's not just one thing. The group runs for 2 hours, and we do a variety of things. So we do some brain exercises. We do sometimes a bit of reminiscence because people's long-term memory is still there. We also do things like looking at the news and discussing the news, because people with dementia often don't want to venture their opinions because somebody's going, no, you're wrong, that was Saturday, not Monday, you know.
Yeah.
So in our group that doesn't come up. You can say what you like.
Yeah.
So, you know, people have still got their own opinions on things like that.
That's
So we do it's a big mix.
Yeah, because we find, I've seen in clients that it's actually incredibly clever how some clients are able to mask their symptoms and
very good social frontage. Yes.
Yeah.
Right.
and
And
know
you're
how
thinking-
to answer certain questions,
Yeah.
to not raise suspicion and things. It's incredibly clever.
Yes, it just shows how clever people are.
Exactly, yeah, because you think, oh no, and the amount of times sometimes that our care professionals have raised concerns that they've got, and we've discussed it with the family, and that clients then refer to the memory clinic, and everything's no, they're all good. There's nothing there. And we think, I feel like this needs, so we leave it a little bit longer, and then the person goes back because they know how to answer certain questions and how to.
Yes.
I mean, yeah, bless them. It's
yes, it's interesting.
It is. It's very interesting.
Symptoms for quite a while. Yeah.
Yeah. So these groups that you run, they're local to our office here in Farnborough.
That's right.
They're over in Farnham, aren't they?
Yes, they are. And I'd happily run one in Farnborough if people wanted it.
Yeah, maybe we can work together on that. And you have referrals from medical professionals for your.
That's right. Yes,
Yeah.
and just sometimes people see things in the news or from somebody like yourself being out there.
Yeah.
So people can contact me whenever they like.
So they don't have to be referred, they can just contact you.
They can contact me directly. In fact, it's best just contact me directly and we'll pick it up from there.
Okay. Do you do like an assessment beforehand or
Yeah, for the group I do. But if somebody comes to me just for help and advice, obviously I'll give that help and advice.
Yeah.
It's a private service. But if people want to join the group, I have to do an assessment just to make sure that really to fit them into the right group, because we run a number of groups.
Yeah.
So yes, that's what we do.
Okay, lovely. So there's medication, obviously tailored to that person, and there are therapies available.
That's right. Yeah.
Do you know of anything else that lifestyle changes and things that can maybe help and slow down things? Or?
Yes, I think over the years, so many things come to the fore, and one thing's popular and then another thing's popular, but all of them help. So singing for the brain was a big thing a few years ago, and it's tended to drop below the radar, but people, it's known that it helps your memory. Singing helps your memory. And particularly, I had a very interesting case of a lady who'd had a stroke and then developed dementia and couldn't talk. Then she went to Singing for the Brain. She sang every single song, and they were all going, she can't talk. She could sing.
Yeah.
So that's tremendously, gave her such a lift, you know.
Yeah.
So singing is known to be beneficial.
Okay.
Singing for the brain, singing for the mind, whatever people.
Is it the singing or is it the music or is it combined?
I think it's
the two?
combined, but it's known that the area of your brain from where you sing
Right.
stimulates also the area of your brain with memory. So it's all sort of, we don't always know why something works, we just know it works. So there's that. Exercise is always worthwhile. You probably know yourself how many people have falls, and if you're better at balancing and you're better at controlling all your movements, so any exercise is good.
Yeah.
Plus, increases the oxygen to the brain.
Yeah.
That'd be good. But the biggest thing I think I did mention to you, uncorrected hearing loss.
Yeah.
Huge risk factor for dementia. So if you are not wearing your hearing aid, please do.
Yeah.
Please get your hearing tested and wear the hearing aids.
Okay. And if they're not working for whatever reason, it is a matter of importance to get that sorted.
Really important.
Yeah.
Really important.
We mentioned earlier that Specsavers do a free home service where they come and do obviously glasses, but they also do hearing tests and things. I think Boots also offer a free hearing test.
Yeah.
So there are resources available.
Most ophthalmologists also do hearing tests, don't they?
Yeah, they do. So
well worth it.
Didn't realise it was such an important part of.
It's known now to be a risk factor for dementia.
Wow.
So the other big risk factor is diabetes, type 2 diabetes. So keep any health problems, tackle them.
Yeah.
The other thing that's very helpful that people don't realise is very simple. It's socialising. Yeah. Just keeping out there, keeping with people. You watch somebody with dementia, they gradually withdraw from a lot of the social contact. So, and that's another reason the CST groups work, because people are socialising again.
Yeah, we see. It's so lovely actually to see when somebody comes on board as a client and their family are concerned about them or they're pretty isolated at home and things, and the interaction
that's right. And you start taking them out and doing something that they enjoy.
Yeah, and the change in them, it's lovely. And it in front of your eyes, you can see the benefits.
Yes, this is what we find with the group. People come into the group and people say to me, oh, he comes in moaning, he comes out smiling. It's just social contact. So it's great that we're both working in the same way.
Yeah, and again, we've both got first-hand experience. We've seen it.
Yeah.
We've seen.
And it's a very nebulous concept, social, contact. It's very difficult to say why it works, but it does.
It does. Yeah. And that's why I think when we went through lockdown and COVID and everything, it was so damaging.
I had so many more referrals after that.
Did you?
Yeah, massive.
Just had no stimulation.
Yeah, massive.
Yeah.
And this type of media, which is great for us, doesn't work for people with dementia.
No.
But it's no good saying, oh, they could Zoom, because they can't cope with that.
No. This is more focused for family members who would want help and advice.
But that would work, but not people with dementia themselves can't get what they need from this type of thing.
Which is why dementia cafes are great places.
Really good things,
and have all the stimulating materials as well. I went to one the other day and they've got all different games. There's the memory books to look at. There's physical
things to feel.
Yeah. I even saw one of the cats. Have you seen the cat?
No, I haven't seen those.
It's actually like a robotic, almost mechanical cat, but it looks like a real cat, obviously. And the technology inside them, it purrs, it reacts to you. It purrs when you stroke it. It rolls over on its tummy. Shows So that if you've got a client or a loved one, family member who's always had a cat, but they're in the stage now where it's not very safe for them to have a pet of their own.
Or a dog, of course, and they could have robotic cat.
Yeah, so they can, and it's
dog as well.
Don't think that I did ask that question because I'm a dog person, but I don't think they're there yet with the dog.
But they'll get
but with the cat, but it's something that
it's something. Isn't it?
It's on their lap. They can stroke it and
lovely
and get that interaction.
I must look at one of them.
Yeah, they're really brilliant. I didn't realise they existed, but seeing it, I think, wow, that is great.
Yeah,
but these cafes that you can go to have all of
they have lots of different things. Yes, and then they are nice because people can go to them together.
Yeah.
And do things together.
Yeah.
Often
or even allow your loved one to go off and do the game that they are eyeing up over there.
While they chat to the
have a chat with another caregiver and discuss how they're going through and things. As many of these groups that we can try and
Yes, don't avoid them. That's the thing. People say, "I don't want to go," you know, but they are lovely.
Yeah.
They really are.
And it's people that go to these, because I've found as well, I've heard a comment of, oh no, everybody's.
Everybody, yes, they're worse than me.
Yeah, exactly. But it's all different stages are there.
All different stages. And because, yes, I've heard people say, oh, I don't want to take her there because she'll see people worse than she is. And then she'll be worried about it. It doesn't work like that. Because people with dementia are not aware in the way that we are of that outside. I'm not putting this very straight, but people with dementia are more focused. So they're going there and they'll just enjoy what they're doing. It doesn't worry them to see somebody worse. And in my groups, I have a mix of abilities. And what I found most interesting is how lovely the group members are to people who are less able. They just sit, they don't mind waiting while they talk or helping them out. It's lovely.
Oh.
So, you know.
Yeah, so
yeah.
One piece of advice is get
yeah,
out there,
yes,
go to these things and
go there and try it.
Okay.
So if you get yours going, I think it would be a brilliant idea.
It's top of my to-do list, find a venue and put a cafe on my home instead. Brilliant. So next thing is the progression of the disease. Obviously, certain stages down the line, you can experience challenging behaviours, very different personality traits to the ones you're used to your loved one having. They can sometimes become aggressive when they've never been that way before.
It's not as common as people think, though.
No,
because I've heard people say, "Oh, don't hope it's not Alzheimer's disease," because they get aggressive.
Yeah, no, not always, but sometimes.
Yeah.
And then obviously wandering with that's
you do have but it's disorientation, really.
Yeah.
People don't know where they are.
No.
And
so my question to you would be, if you are experiencing these challenging behaviours and it's a new thing and you're thinking, oh gosh, what do people do? Where do they start? What advice would you give?
I would say, read my book.
Shameless plug there.
No, but it's just that all the knowledge and information that I gained when I worked with people with dementia so closely is I wanted to put it out there into the book. It's a reference book, so wandering. Oh, let's get it down.
You've got a
chapter. Yes. On the other hand, the other thing is just ask for help. I just think people don't want to ask, but you know, if the help's out there, it's available. Ask. Go to your doctor and say, look, this is happening, or go to the health professional. Quite often GPs don't have an extensive knowledge of dementia, so if you've got another health professional, a nurse or someone like myself, go to those people and ask them.
Yeah, okay.
So they will have, they will be able to help you with ideas. Not the same thing doesn't work for everyone. As one client said to me the other day, oh, I told him to wait until tomorrow. I read that in your book, but he remembered the next day. I thought, it doesn't always work.
No,
but you can try different things, and some things will work for some people, and some things will work for other people. It's very personal.
Yeah,
we've all got a different brain.
Yeah, exactly. Yeah. So you have to have tailored advice.
Very much so.
Which is definitely why it's worth going to somebody like you who could give the tailored advice, not just generic.
Perhaps knows the person.
Yeah.
Because there's a different way of dealing with different people.
Yeah, of course.
You must see that in your work.
Oh yeah, 100%. Yeah, we have totally tailored care plans that are regularly reviewed to make sure that we are up to date with their specific needs at all times.
Absolutely.
So wandering, let's just think about that as an example. Does that mean if somebody starts wandering, does that mean that they then aren't safe to stay at home, or are there things you can put in place to manage?
Well, it's difficult. I'm not sure. There's wandering and wandering. Some people are just getting lost because they've always walked to the local shop for a newspaper and suddenly they get lost. And you think, oh, I'm not going to let them do that again. Or some people will get out of the house when, the wife's watching TV and the husband decides to go for a walk. So when you say wandering, it's a very generic term.
Yeah.
It doesn't mean people aren't safe, but you do have to put precautions in place, obviously.
Yeah.
The problem, I think the biggest problem is that if somebody gets lost, somebody has dementia, finds themselves lost, you or I would say, oh, I'm lost, I better stand still, try and work out where I am, or ring something. But people with dementia don't do that. They tend to keep walking, keep walking.
We've had instances where it's amazing how far people have got.
Incredible.
Yeah. But just thinking about clients that we have and their families and how they cope, I know that there's technologies available, like they're called Apple AirTags.
Absolutely, there are a lot
that they can wear as a watch.
There are tags, and of course, just plain mobile phones now. You can track.
Yeah, you can track them.
Mobile phones. Even if they can't use the phone, it's worth the person with dementia carrying it.
Yeah,
because they can be tracked.
Yeah,
Most people don't realise you're being tracked all the time on your mobile phone.
No, it's not always a good thing, but in this instance, it's very useful.
Yes,
but if you know, for example, your loved one will always goes out with their keys or always takes their handbag, no matter what, you can pop a little something in their bag or attach it to the keys, and then you know.
Yes, absolutely. There's also the sunflower lanyard, which is an internationally recognised piece of equipment. It's just a lanyard.
Yeah, like similar to this, but it's green with yellow.
That's right, with the yellow sunflowers on. And if you wear it, people know that they can approach you and say, "Do you need help?" And it's used an awful lot at airports because then people know that that person can't manage to get through security on their own and things like that. But it's worth wearing out if you take somebody out somewhere, just putting it on, and then the public will know that person has a problem.
Yeah.
So that's good. That's a good one.
There's a Herbert protocol in place as well, isn't there?
That.
So that's where if you are concerned that your loved one might start to wander, or they have had an instance of wandering and you're worried, you can let your local police know. They have a picture of the person on file, information about them. And
I did know that the police. I didn't know that it had a name.
Herbert
I
protocol.
did know that the police do that, and it's worth, if your loved one is liable to wander, have a photograph available. And somebody pointed out to me, not head and shoulders, but full height, because that's what you're going to see. If you're running around the streets looking for somebody, you're going to...
you don't see a passport photo of somebody, do you? Yeah.
So have a photo available, because then if people are searching, they know what to look for.
Yeah. But
so some low-tech things work just as well as some high-tech things.
And it shows that there are all sorts of things that that you can put in place that means someone can stay safe and be in the home that they love.
Absolutely.
Because that actually leads me really nicely on to my next question, which is why is it important for individuals to remain in a familiar environment when they are living with dementia?
Do you know, that's a brilliant question, because it's one of the most important things, because people with dementia find it very difficult. People think they can, but very difficult to learn new things. When you put people in a new environment, they will find it really difficult to settle down in that new environment. In their own home, in their familiar surroundings, often people will cope. That's why we sometimes don't know people who've got dementia, because they start to retract from all their social, but they're staying in their home, they know where everything is. If you can keep people in their home environment, that is really good for them.
And it's often with the generation that we are caring for, they've been in those homes for 6 years, 7 years.
And think how familiar that is, every piece of furniture to
exactly. Even to the point where, this is a good example, Home Instead offer free falls assessments. So we go out and assess a client's environment to make sure that they're living as safely as possible. And we had a lady who I noticed there was a big doorstop right in the way in the kitchen, big heavy doorstop, and it was propping the kitchen door open. And immediately you think, oh, trip hazard, if site's not very good. But actually, I thought we will probably do more damage removing that because it's always been there. It was clear, it was very old, dusty cat thing.
She knows exactly where.
Exactly, and I thought we could do more damage moving that.
That's very good.
Than actually leaving it in place, because, like I said, these people know their homes.
They know their inside out. Yeah, and they know which chair to hold on to when they get up.
Yeah, exactly.
Yeah, it's very important, I think, to keep people in a familiar environment, and you tend to notice people go downhill after moving house.
Yeah.
And definitely if they go into a care home.
Yeah, we find there are things that the care homes do, like familiar pictures on the walls.
Oh yes, they do everything they can.
Yeah, but it's not the same, is it? No. And staying at home is an option.
Staying at home is getting more and more of a better option these days. Yes. And even financially, it's often living care can be about on par with a care home.
Yeah.
So,
and then obviously you get the one-to-one with living care, which you don't.
That's right.
They do as much as
and
they can.
Familiar environment and everything.
Yes, and it's one-to-one. It's tailored to that person all 24 hours a day, basically.
Yeah. But often people can stay in their own homes for a really long time if they have a little bit of help.
Yeah.
And that's the important thing.
And things like the garden that they've curated and loved for all those years, and can't quite get down to do the weeding anymore, or the path's uneven, so they're worried about tripping. If you have that person with you,
They have someone with you, they can pull that odd weed, or
exactly, or let's go down to the greenhouse, watch the step there, hold my arm, or and all of that. They can still do those things.
Can do all those things
that they've always loved.
Yes, absolutely.
Yeah, I was just telling you earlier about an example when I went yesterday to see a client and a care professional who were making marmalade.
Yes, it sounds true.
Oh, and I had a taste.
But she loved it.
It was nice because marmalade is something
She's got a jar.
Well, she said they eat that much of it themselves, and I didn't want to deprive them, so they're all in the larder. As I said, her husband loves marmalade, has it every morning. She's always made it for him, but now her sight's so bad that she could only see shadows.
So you could help her with it?
Yeah, it's something she never thought she'd be able to do again.
It made a huge difference.
Yeah, but our care professional was like, let's tackle this. I've never made marmalade before. You can teach me. She loved teaching her, and it's remarkable how amazing she's still. Knife skills and everything, they're all still there, even though she can't see the things. It's
very important to personalise your care in that way.
Yeah, definitely. Lovely. Okay, so that's why it seems important to stay in your familiar environment. And then if we move on to we're good for time. So if we move on to the people who are caring for their loved ones at the moment, and if they are struggling, let's just put it in that term. They've got, I don't know, maybe they're still of working age, they've got full-time jobs still, they might even have children to deal with, they've got an older parent who they're trying to help, support.
Sandwich generation.
Yeah, exactly. These are the people that we are talking to today, hopefully. They're stressed, they're reaching a point of burnout. What advice would you give to that group of people that are just at their wits' end at this point?
The prime piece of advice I give everybody when there's a diagnosis of dementia is accept help. And everyone will go, oh, no, we don't want to trouble anybody. Accept help, ask for help. A lot of people want to help. And with a little bit of help, like you said, you can stay in your own home, you can carry on doing the things you want to do, all that. The help is out there. Take it, ask for it, accept it.
And what if you, as the daughter, understands you're at the point where your parents need more help than what you can provide? You're doing your best, but it's just not enough. But your parents or mother or whatever,
no, I don't need
resistant. How would you approach that? And
there's lots of ways. There's no one size fits all really for that. But often, if somebody's actually got dementia, then your best bet is to say, well, I'm bringing somebody in to help. And they will often just back down. This happened to me with my mother-in-law. She said, no, I don't need anybody. And in fact, I had a care agency manager in there. She did the whole thing. And my mother-in-law said, thank you very much. I'll contact you if I need you. And I said, no, Eileen, she's coming next week. All right. And the next week, that lady was her best friend.
Oh, really?
Which shows how good the care was.
Yeah.
But yes, I think sometimes you have to say to people, this is happening. You don't want to steamroll people, but sometimes you just have to say, well, we'll try it out. She's coming for a week. If you don't like it after that.
Yeah. And we often find that we'll start off just literally emptying the bins.
Yeah. Or come in for a coffee.
Yeah, have a cup of tea. Oh, do you want me to just take these bins out while I'm here? It's really small. Don't feel like you're intruding. Nothing. You're a guest in their home.
Involved. That's right.
Yeah.
You just get to know them, and then you can start to find your way in.
Yeah, and then like you said, get to know that person as much as possible, and then you find the ways that they might appreciate the help.
Yes, they might want that. They might want that help. They might not want you coming and cooking them a meal, but as you say, if they can help take the bins out or empty the waste paper baskets or run the hoover around, maybe that's okay.
Yeah, and then especially then when they are a bit further on down the line and there's
more
the personal care perhaps is needed at that point, they already have the trust, the relationships built.
Absolutely, build the relationship first.
Yeah. Okay, so you think start slow. Well, first of all, ask for the help.
Yes, always ask for help.
Yeah. and then start slow.
Yeah,
And
start
introduce
slowly and just take this just a little bit.
So the person still feels involved in the decisions that are being
Yes,
made.
and
They've got
to feel in control.
Yeah, totally.
Yeah.
And I, yeah,
We all do.
Yeah, we don't want anyone.
No.
Right, I'm getting a cleaner in for you. And you're like, oh, great, thanks. So yeah, it's yeah, you want to feel involved in the
So
decision.
it's Mum, just try it out. If you don't like it after 2 weeks, well,
Yeah.
and as I say, my mother-in-law, within a week, when the carer went on holiday, she was most upset.
Oh, really?
Yeah.
Oh, yeah. So that's the key, isn't it? It's
Yeah.
the consistency, the same person, and
All the time, that's
Yeah.
right. And the relationship.
yeah.
Yeah.
Oh. Okay. So hopefully, with the advice that we've given, we're helping some people
so.
today and making that decision to.
Yeah,
To
it's a
reach out.
hard decision. It's hard to give up, being the person who helps.
Yeah.
But sometimes somebody can help in a better way.
Yeah, or even a husband and wife dynamic, let's say you're caring for your husband or you're caring for your wife, and you are that person, you don't want anybody else to be involved in that, and that's your domain. That's fine, and that is totally your prerogative. But why don't we, maybe while you're providing certain types of care to your spouse, we could come in and prep the dinner for that night and take that one job
thing less
off you. Yeah.
That's right.
Or like I said, run the hoover around, do a bit, keep on top of the house for you while you're being that primary carer for your spouse.
But also, I think one of the chief things is, if you are husband, wife, son, daughter, once you start doing the hands-on care, you start, well, it's a burden. I'm a carer. If you let somebody else help with those things, you can be a wife again. You can be the son or the daughter again.
Exactly.
And the whole dynamic changes.
Yeah, we do say that as well. We come in and do those bits.
I noticed clients where I've persuaded them to get some care, and then they'll come in next week. It's the best thing you ever did. Yeah.
Yeah, I'm thinking of an example right now where I had a lady actually say to me, like, you've allowed me to be a daughter again.
Yes.
Because she used to go around and do as much housework as she could
cleaning,
do.
and get doing all of that. Make sure she's washed her hair.
Yeah, all of that. But now we took over that bit, and they can just have a lovely time together and go and sit in the garden and have a cup of tea, or even go to the garden centre, or those other things.
Makes a difference, doesn't it?
Yeah.
Yes, I think that's important.
Yeah, I'm not sure people.
Keeps your relationship, takes it out of that care relationship and puts you back on the old footing.
Yeah, exactly. I do think people don't know what's available for them.
I think that's true. And I think everyone's reluctant to ask for help, but really just a little bit of help can make a massive amount of difference.
Yeah.
You can start small.
Yeah, exactly. Well, just going back to what we were saying about falls, that second pair of eyes quite early on.
Seeing something from a different viewpoint.
Yeah, exactly. That can prevent a major fall in that person. And
I think you mentioned to me somebody about walking around with, or did I mention it to you, that I saw somebody wearing slippers that made her slip around? And this is a few years ago. And she said, I keep falling over. And I realised it was because of the shoes she was wearing.
Yeah.
And once we persuaded the carers to find some decent slippers, she didn't fall over.
Yeah, exactly. I think the example I gave you, the lady who loved her wedged slingbacks. And wouldn't be told. No, I've always worn them absolutely fine, and they were beautiful. She looked lovely in them. But we noticed that one heel, especially on one side, was slipping off each time. And the daughter said, I've explained this numerous times, because it was coming from somebody else.
She listened more.
Yeah, straight
Yes,
away.
because which of us listens to our nearest and dearest? We don't, do we?
You're almost too close. So you almost need that outside voice.
Yeah.
Brilliant. Okay, so we've not had any questions come through so far, so that clearly means that we are answering everything. Yeah, we're going into detail about everything. So I don't know if you wanted to mention anything in particular in your books that you might that you think people might find helpful. The Essential Carers Guide, is that your very first?
No, it wasn't the first book I wrote. The first book I wrote was just called The Carers Guide. This is about dementia specifically, and it's made as a reference book, really. So it isn't, you can read it cover to cover, I don't mind. But the basic thing is, you think, like you said, oh, why has he started wandering? What can I do about it?
Yeah.
The idea is that you can pick it off the shelf and keep that on your shelf and look at it when you need that little bit of help.
Okay.
So my latest book is this one, shameless plug, Dodging Dementia, which is about avoiding understanding mild cognitive impairment, which is like a precursor to dementia, and how you might be able to make changes to your lifestyle to hopefully avoid developing dementia.
Yeah.
We don't know, because we don't know what causes it entirely, but there are things we know we can do.
Right, okay. And what are things like diet and does that?
Yeah, exercise, diet, but not falling over and not ending up in hospital.
Yeah.
So your falls thing is, I would have, put that in as a recommendation. And I do say in there, avoid falling, which sounds nonsense, but avoid things that will cause you to fall.
Yeah.
I mean, accidents happen, but hopefully we'll avoid.
Yeah, if you can eliminate all
Yeah.
those the risks that are obvious, then
Yeah, and deal with small health problems
Yeah.
like hearing and sight. Sight is another one. Get your eyes checked regularly, because if you can't see, you're going to fall over.
yeah, exactly. Yeah.
So small things can make a difference.
Yeah.
Yeah.
Even certain medications. If you're given a new prescription, it's making you feel particularly dizzy.
Yeah. But blood pressure medication is a major one in that way, because it tends to be a standard dose. They'll give it to you, and then it lowers your blood pressure too dramatically. And you do. And happened to one of my clients the other day, and her GP said to her, as you get older, you need to have your medication reviewed. So you may not need that level of blood pressure medication, because it may be making your blood pressure too low, and then you will collapse.
Yes.
So yeah, medications should be checked regularly.
Yeah.
And don't just assume that you need it. Always ask the doctor why he's giving it to you. Why are you giving me this? And what side effects might I notice?
And also that it might not be the right medication for you. The doctor can try something with you, but you have to speak out and say, look, I don't like this one. It's not agreeing with me. It's not making me feel good.
Yeah.
They can provide an alternative. You don't have to stick.
Health savvy. I mean, I did have a lady say to me once, if the doctor tells me to take a pill, I take it. And I thought, oh, yes, you want to listen to the doctor.
Yeah, of course.
Of course you do. But ask why are you giving me this pill? What's it going to do?
Yeah, don't be afraid to
What can I
question.
expect? And then if it's not working, go back.
Yeah,
As you
exactly.
say.
Yeah, regular reviews are definitely needed. And as we know, the NHS, it's overrun. It's so busy. They haven't got the time to always check in with you and see how's that going.
I would recommend people get on side with their pharmacist, because pharmacists have a better understanding of how drugs can interact with each other than doctors. They have more time to start to look, and that's what they're about. They're about medication. So ask the pharmacist, is this going to interfere with the other medication I take? Then you can go back to the doctor and say, well, what about this?
Yeah. So, and that takes out all the waiting time that you can just pop straight.
And the pharmacists are there and they want to be used.
Yeah. I've heard a lot more actually in the media and everything, trying to tell people to utilise their pharmacists a lot more. Yeah. And it doesn't have to be.
No, and when it's medication, that is their whole remit is medication.
Yeah.
So
that's really useful advice, actually. Yeah, ask your pharmacist if you're not sure.
And I always suggest to people, if they're diagnosed, to stick with one pharmacist. So they will begin to get a picture of your health needs, rather than, I'll go to Boots here and I'll do the pharmacist down the road tomorrow, and I'll stick with one. Yeah. Because they get to know you. Okay, great. So we're just going to summarise then everything that we've said. Hopefully it's been helpful. I feel like, the lack of questions means that we've answered most things. Sure, I hope so. Yeah. So if all I really wanted to say towards the end is if you feel like after listening to this webinar today that you're ready to accept some support, or you want to look into options of support, do give us a call at home instead, or anywhere that you feel you would like to go to. We provide free advice, as you do, Mary. Yep. And we can signpost you to the best place to go, as well as offer all the support ourselves. And then Mary's books, they are all available on your Adapt Dementia website. Yep. There is a buy now button that you can just click on and order it there, or they are also all available on Amazon. I would recommend getting the books, even like you said, don't have to read it cover to cover, but if there's reference points in there that will help you. They are all available as ebooks, but I always think a reference book is better in your hand because it's quite difficult on an
Yeah.
ebook to flick around.
Yeah,
isn't it?
fair enough. But so you can get them on Kindle.
You can get, yes, you can.
Well, that's very useful to
Yeah.
know. But yeah, lastly, I would just like to say thank you very much. I really appreciate that
It's been
you taking the time to
really
come in.
nice to meet you and to talk to all your clients.
Yeah.
And I hope we, you know,
Yeah, I
give
hope
them
we've helped
something
people.
worthwhile.
Definitely.